Taking care of business on Saturday mornings on WHP 580. I'm Michael Parks, and thank you very much for continuing your morning with us here on WHP 580. We are taking care of business, taking care of our local businesses and organizations. This company is an employee-owned company, local company. They've been with us pretty much since the start. It's our good friends at CPRS Physical Therapy. They are the hands that heal, the hearts that care. Physical therapy, wellness, and so much more. And today we're going to be talking about how you, if you should need them and keep them in mind, how easy it is to take advantage of their incredible work and their incredible expertise at CPRS Physical Therapy. Joining us today is Mark Brown. Good to see you again, Mark.
Thanks, Michael. I appreciate you having us again.
Hey, first of all, let's talk about, for some of the folks who are not aware of CPRS and all that you do and all your locations and things like that, just give us a little description of what CPRS is all about.
CPRS, as you mentioned, is an employee-owned company. We are physical therapy services, outpatient primarily. We do have one hospital contract in Lancaster area. We also have several athletic training contracts throughout the mid-state. We're in 5 different counties with 26 locations, so we have locally accessibility to multiple people. Our website would give you general directions, locations, access, and hours.
The one thing I've learned about you is the incredible staff that you guys have. You guys definitely, bring out and train and provide people with the best of the best.
It helps that we're an employee-owned company, so people are vested as, an owner in the company themselves, so they're representative of what the company is. So we instill those values. We look for those in the people that we hire, and then we do mentor people and train them to be hopefully at the top level of performance for clinical, clerical stuff. Customer service is critically important to us. The
other thing that is important, and I've learned this in the last meeting that we had with you down in Lancaster when we were talking about diabetes, is as well as you help people heal, you also help them stay well. Your wellness programs are really a huge part of what you're all about.
Yeah, definitely. I mean, the way healthcare is going, we have a lot of epidemics, diabetes being one of them, obesity being another. A lot of times they go hand in hand. Our wellness programs have healthcare professionals that have the skills and knowledge to help manage those diseases. Exercise is one of the best treatment options for a multitude of those health conditions that are, potentially lead to other things, heart disease, life-threatening type of stuff. So getting the right type of exercise, understanding how that's addressed is important. Having a professional that's trained, either an exercise physiologist through one of our wellness programs or a physical therapist, can help give a specific exercise prescription to help address those medical issues, not just maybe a specific musculoskeletal complaint that they may have.
Manufacturing and all kind of businesses that we have here in our area in central Pennsylvania. There are a lot of businesses too that you specialize in and help out with the occupational health, helping to prevent injuries.
Right, and it's a big issue. Everybody knows that healthcare costs are one of our primary concerns globally. So we need to be able to address those things, and what we can do is actually help employers reduce their costs by reducing the likelihood that they're going to have as many reportable claims from their workforce. The more you are ergonomically correct in what you're doing, the more healthy your employees are, that is, the less likely they are to have an injury at work. Just some basic types of things, but having the knowledge and the expertise to do it is one of the things that we specialize in.
And of course, CPRS is huge with the athletes in our area. They take care of a lot of the athletes, the teams of the City Islanders, highly involved with the Big 33. And of course, one of the things we always promote, how you can, when you're a successful business, one of the most important things is that you give back to the community. And CPRS has been giving back through their Toys for Tots and cell phones for soldiers and so much more. So they're really, really involved in our community. All right. This is the time of year we've had some bad conditions with the weather, slippery conditions, people falling, accidents and things like that. When people get hurt, the most important thing is that they need to seek help. And one of the things that you and your staff has always talked about is to seek help immediately. And the way that you're making that accessible and available to us here in central Pennsylvania is through a term called direct access. So let's talk a little bit about direct access, how important that is, and what makes that so special for us.
Let me just kind of define that for you. I mean, direct access, really the purpose of that is to give the person who's the consumer of their own healthcare accessibility to physical therapy services at a convenience. It's your ability to go directly into a physical therapist, be evaluated and treated without seeing your physician or somebody else with a referral first. There are some limitations in that based on insurances. However, there's been a great push. I have an article with me that was published in the Journal of Physical Therapy just discussing, as I mentioned before, the cost. If you have a musculoskeletal injury or sometimes vestibular issues, anything that physical therapy can treat, getting directly to the therapist early is going to help to reduce the length of care that you receive. A lot of times it's going to avoid or eliminate unnecessary tests, x-rays, MRI that may not be necessarily indicated for their type of problem. The physical therapists are really the musculoskeletal experts and should be consulted first when you have that type of injury ailment. Direct access gives them the accessibility to come in. They can be treated for up to 30 days without seeing their physician. That is one of the limitations. However, if there's a required plan of care that becomes necessary, they do have to at some point at least have a consultation with their physician so that they would be able to continue.
One of the things that we've been hitting since you've been on the air with us is that you do have a choice when it comes to physical therapy. A lot of the doctors in the area, and I've experienced this through some of the injuries that I had, is that when you go to certain doctors or your primary care physician, they may prescribe or recommend physical therapy, and then they may send you to somebody that they know or their practice is affiliated with. And one of the things is, again, we keep on pointing this out, with CPRS having the best of the best and what you guys do, you do have a choice when it comes to choosing physical therapy.
That's correct, Michael. Regardless of what your physician may say, if you've had an experience before or if you would even like to see what the therapy services are about, you can change in the middle of your plan of care to another provider. But they do have the ability to choose directly. A physician might have some vested financial interest in where they're making referrals. We would hope that doesn't occur and that they have the best interest of the patient in mind. But there are physician-owned services. Oftentimes, the physician will send them there because of what they would call convenience. However, the convenience may be disregard to the patient. It's more for their convenience. So I think it's about getting the patients to the place that they would choose, recognizing that they have a choice regardless of the direction, and that we would communicate with their physician regardless of what their recommendations had been.
Which we always recommend, because if you're going to go out shopping pretty much like anything else when it comes to your body and your healing, you would think that, you would do your research. And that's why the folks at CPRS are always welcome. If you go to any of their locations and set up a time with them where you can tour the facilities and see what makes them different, what makes them better, then in the future, if you or your family members should need care, then you would, consider CPRS physical therapy. We do have a special guest in the studio with us, along with Mark Brown from CPRS Physical Therapy. Mark, why don't you introduce us?
Michael, this is Kay Baker. Kay has been a patient of mine on multiple occasions, and she's had the benefit of coming direct access, and we've had some success with various ailments that she's gone through, and she was kind enough to come along with me today just to give some indication of her experience with direct access and our services.
Yeah, Kate, why don't you tell us, why you chose and what happened and why you ended up at CPRS?
Originally, I ended up at CPRS because I had pain in my ear, which was actually related to my neck. So the first time I went there, it was for treatment for my neck.
Why did you choose that? Did you know about direct access, or did you just have this pain? And, tell us exactly, what brought you, why you chose CPRS.
Convenience.
Yeah.
It's close to where I live.
Right.
I had some family members that had gone there and had a lot of success with CPRS. I think the convenience and the fact that I could get in quickly, that the problem wasn't going to keep going on, was really, really helpful. The first time I went for the neck thing, though, what came up with that was that I also have vertigo, and the vertigo has been something that I have continually use the direct access for, because I can go right away. It doesn't need to get any worse. It's a debilitating kind of thing. I don't have to wait until it gets really bad to go.
Yeah. And something like that. And when you go there, from what I've known personally when I was there, is just the way that you're treated by the staff. It's really neat. They make you feel special.
Oh, that's absolutely true.
Yeah.
Or I wouldn't keep going back.
Yeah, exactly. So how the other thing that we always talk about with Mark and his staff at CPRS is while they love being and seeing you and helping you, they don't want to keep on seeing you all the time. So they're able, like in the case of your vertigo, I mean, were you able to learn some exercises and things like that you can use and make it a little bit better?
Yeah, I have exercises I do on a daily basis. If it gets to the point where I can't manage it on my own, though, I would call and go back, because I can go right away.
Exactly.
I can just go in if I feel that I need to go back again. In fact, it's been helpful to go quicker rather than later. And for me, I think that's where the direct access really helps, because it doesn't have me hesitating. I can just call and make an appointment and go in, and somebody will see me. And actually, that's been sometimes the same day.
Wow.
Or at the latest the day after. So that's where the direct access helps me. It doesn't have me staying and feeling badly long.
Yeah, because any of us who are going through pain or discomfort or something that just totally messes up your day and your life, you want immediate. Everybody wants stuff immediate, and with the medical field, so much and so long is that you have to call, and you're on hold, and then you make an appointment. But with direct access, it makes it easier. And again, Mark, keep on emphasizing the point, because, and I know from previous patients that we talked to, especially like athletes or somebody, hurt their knee, hurt their shoulder, the ability to be taken care of and treated immediately is important.
Yeah, typically we're seeing people, like Kay said, in a 24 to 48 hour period. Now, certainly we're screening for higher level medical issues that may be there, that may require the attention of a physician. So I have had individuals who have come to me for therapy, athletes specifically, that maybe need an x-ray. They had a pretty bad ankle sprain during a basketball game, and they're not sure if they had a fracture. They're having trouble walking on it. I'll examine them first and be able to make the medical determination of whether or not an x-ray would be appropriate, or if they, what the line of care could be. And sometimes it's just physical therapy, and if that's the appropriate care, then that's what they get. Obviously, as Kay mentioned, something like vertigo, you certainly would want to rule out any other neurological condition that could also have the symptoms of vertigo or dizziness. So we're certainly not looking to, have somebody who thinks they may be having an acute stroke or something of that nature just call for physical therapy. On the other hand, I have had people who have had a significant medical workup, who have called the ambulance because they had an acute vertigo attack. They get an EKG, a CT scan of their brain. They're in the hospital all day, and then ultimately they're sent home with medicine. Nobody actually treated the condition or discovered what it was. So a physical therapist who's well-trained, and ours are all well-trained for this type of impairment, would be able to recognize that quickly and save a lot of healthcare dollars and a lot of time and frustration. Sometimes you can't get into your doctor for, as you mentioned, 6 months, a couple weeks. That's why all these urgent cares keep popping up all over the place. But they're not going to be any different in terms of their ability to treat you unless it's something that they're going to say you need to go to the ER, x-ray, this or that. So physical therapy is really a lot of times where people are going to end up with their musculoskeletal types of problems or vestibular problems. And why not just go there first? Yeah.
And I know this, and Mark knows this personally with my wife. She was having problem, and they kept on shooting her with cortisone. And it was painful for her, and she couldn't, it would ease the pain, but it was painful to the start. And so she went to Mark, and Mark was able to treat her problem and give her exercises, and she's doing great. So, while the medical facilities and things like that have their purposes, a lot of times it's, it merely is that proverbial Band-Aid on there that doesn't find the actual cure and what's exactly causing the problem. So take advantage. If you are hurt, keep them in mind if you are going through pain. And again, as Kay mentioned, it doesn't have to be, a sprain or a problem or, surgery of muscle problems. It could be, vertigo. It could happen with your neck, your back, your hip. elbows, shoulders, so much more. CPRS Physical Therapy. They are the hands that heal, the hearts that care. Learn more about them and the locations nearest you and how to get in touch with them by going to their website, which is cprsweb.com. We will continue our conversation with the folks from CPRS. We are taking care of business on Saturday mornings on WHP. Taking care of business Saturday mornings, WHP 580, Michael Parks along with Mark Brown, and also Kay from CPRS Physical Therapy. Kay is a very, very happy patient with CPRS, and she took time out of her busy day to come in and talk about the folks and all the services and all the good things that they have done for her to help make her feel better and enjoy life better. Today we're talking about direct access. Again, Mark, quickly, direct access.
Direct access, you can come directly in to see a physical therapist. You can be treated for up to 30 days. Most insurances cover it. If it does not, we would be able to verify that for you, let you know. We would easily be able to make a referral for you to a physician if necessary. Again, one of the things that I mentioned earlier, Michael, is if it's not a musculoskeletal issue and we're screening for it, we would make an appropriate referral to their physician and communicate with them. If it's something that's not responding as we would have expected, maybe we treat them for 2 or 3 weeks and we're not seeing the progression we would expect, we would also then make an appropriate referral to the appropriate medical professional at the time, just your general practitioner, orthopedic physician. Sometimes it's an ENT, ear, nose, and throat specialist if it's a vestibular issue.
Yeah, because from what myself and my wife and my mother-in-law, when we go through CPRS, one of the things that you initially do, there's quite a bit of a screening and paperwork to find out exactly what your pains are and what your expectations are and what you hope to achieve through physical therapy. So one thing we want to point out is while we are advising you and urging you, saying this is available to you as an option, direct access, because if you are injured, then the sooner that you get treatment, the better. But as Mark mentioned, and I think we still want to point out, it's not like separating you from the medical practices or your family doctor, things like that. CPRS and the staff here work closely with the medical community.
That's correct. And we would communicate anything they would like us to in regards to their care with their physician, so that they know that that's part of that. We would consider ourselves part of that medical practice.
Well, Kay, we were talking during the break, and Kay was telling us her story about how she was being treated for vertigo. And I asked her, I said, well, was there anything else that, they treated you for? And she laughingly said, well, she goes, I've been there for a number of things. But, the case in point is, let's talk about, like your shoulder, for example. What was wrong with your shoulder and how do you feel now?
My shoulder started giving me pain, started waking me up at night. I was losing some range of motion, and it wasn't getting better on its own. So I called. I can go through direct access, and they saw me, I think, within the day, and I finished that treatment just at the end of December, actually. And my shoulder's actually better than actually before I injured it. So it's much, much better. I have range of motion. I don't have the pain. I'm able to do the things that I want to do. And I think that's the big thing. Like I can do the things that I want to do. I don't feel limited. I think for me, the other thing is because I have the direct access, I go more quickly. And I think what that does is, if you have something that's injured and you don't take care of it, the rest of your body will accommodate, and sometimes it hurts something else. So I think for me, I go right away, and it doesn't make the injury any worse than it already is.
Yeah, because you're compensating. Because if your one leg or your one shoulder hurts, then you're working the other one. You can injure that as well. Well, it's been some great stuff here. Kay, thank you so much for coming out and sharing your stories with us. And Mark Brown from CPRS Physical Therapy. It's called Direct Access. You can learn more about it by calling or visiting any of the CPRS locations, or go to the website to learn more about all the things that they do at CPRS. Their website is cprsweb.com. And, of course, all the contact information, and you can hear this interview again on our website at WHP580.com. Click on Air, then Michael Parks. Medical Matters is up next, followed by The Plant Doctor, and I will talk with you next Saturday morning at 7. We are taking care of business on Saturday mornings on WHP.